Mari verifies the order of medication to be administered with the MAR. She checks the 5 rights of medication administration, including right patient, right medication, right dose, right route, and right time. She also reviews the medication reference information, assessing the compatibility of medication with the existing IV solution. Now Mari collects her equipment and medication. The supplies that she will need to set up the piggyback include the medication, the secondary tubing, gloves, alcohol prep pads, and change date label. Upon entering the room, Mari performs hand hygiene, applies non-sterile gloves, and confirms the patient with 2 identifiers. She compares the label of the IV bag with the MAR one more time. At this time, she also confirms that the primary infusion is the correct medication. Before administering any IV medications, Mari checks the IV site for infiltration or phlebitis, which would be indicated by pain, swelling, or redness. Mari puts the extension hanger on the existing primary IV bag and returns the bag to the IV pole. She picks up the secondary tubing, closes the clamp, and attaches the piggyback medication to the secondary tubing using aseptic technique. Now Mari uses an alcohol pad to clean the port on the primary tubing closest to the drip chamber for 30 seconds. After letting the alcohol dry, she connects the ports using aseptic technique. While holding the bag upright, Mari primes the secondary tubing by opening the clamp and holding the piggyback lower than the primary bag until the air is cleared from the line and fluid has reached the bottom of the drip chamber. Then she closes the clamp, hangs the bag, and squeezes the drip chamber to allow medication to fill it halfway. Prior to programming the pump, Mari ensures that the secondary piggyback is hung higher than the primary bag. At this point, Mari would program the Alaris pump to infuse the medication at the correct rate, a skill which is shown in the video, How to Program an Alaris Pump for an IV Piggyback. After programming the pump, she then confirms the medication is dripping into the chamber from the secondary bag and applies the change date label to the secondary tubing. Mari removes her gloves and performs hand hygiene. She records the medication administration on the MAR and monitors the patient for signs and symptoms of adverse reactions.